It is now time for oral questions. I recognize the Leader of the Official Opposition.
Thank you, Speaker. Thank you, Speaker. My first question is for the Premier. In recent weeks, private, for-profit healthcare providers have been coming forward to declare their interest in being part of the government's healthcare scheme. In London, Ontario, a private clinic owned by the Advanced Medical Group says they're ready and willing to take on surgeries at their private operating room. And in Toronto, a private option clinic, calling itself, quote, Mom and Baby Depot, says they're excited, I quote, excited to build and be part of an Ontario health team, end quote. Can the Premier tell us, will for-profit corporations like these ones be allowed to be a part of Ontario health teams, yes or no?
Premier?
Well, through you, Mr. Speaker, I just have a couple quick comments. You know, we may disagree in this chamber, we may spar back and forth with each other, but I just want to pass on my condolences to the MPP from Essex. His father passed away, and on behalf of the PC caucus, myself, I gave him a call. You know, when it comes to family and politics, we separate family, and then we come back in here and we go back and forth. But I just want to give him all my respects and wish him and his family all the blessings.
Supplementary.
I want to thank the Premier very much. Of course, the member for Essex lost his father on the weekend, and I appreciate very much the Premier's remarks as well as the condolences from the rest of your team as well as the other members. Very much appreciated. Back to the question, Speaker. The Premier insists that his multi-billion-dollar mega health merger isn't opening the door to private health care, but families are finding that pretty hard to believe. To give just one example, the London area private clinic that I mentioned isn't just pushing for more for-profit care. They also hosted the Premier at an event during last spring's election campaign. It seems like a pretty cozy relationship. So again, my question to the Premier is, will for-profit corporations like these be allowed to be a part of Ontario health teams, yes or no?
Minister of Health.
Minister of Health and Long-Term Care.
Well, I thank the Leader of the Official Opposition for the question, and I extend my condolences to the member from Essex and his family as well. But to the specifics of your question, what we have stated from the very beginning is we are trying to strengthen our public healthcare system with the introduction of the plan that's contained in Bill 74. That is what it's all about. We want to make sure that people get the connected care that they need and deserve, and we are going to be working with Ontario Health, issuing very strict criteria for any organizations that want to band together to become local Ontario health teams. They're going to have to, first of all, meet the criteria of being able to manage the funds that will be allocated to them. They have to make sure that they maintain the quality of care that will be expected from them. And they also need to continue to involve patients and families in all aspects of designing the care and delivering the care.
Thank you. Final supplementary.
Well, what I was hoping to hear from the minister is that they can do all of that work in a not-for-profit manner, Speaker. That's what we're wanting to hear from this minister and this Premier. But here's what families see. A Premier that's promised no layoffs is already firing nurses, frontline healthcare workers and other health professionals. Meetings are being held behind closed doors without any public input or accountability. And private for-profit health interests seeking to profit from our healthcare system already seem to have the Premier on speed dial. So will the Premier do the right thing by the people of this province and be very, very clear? Will for-profit corporations like this be allowed to be a part of Ontario health teams? Yes or no?
Members, please take their seats. Questions been referred to the Deputy Premier and Minister of Health and Long-Term Care.
Well, first of all, I can assure the Leader of the Official Opposition that the people of Ontario will be receiving the care that they expect and deserve should Bill 74 pass, which I urge you to support, because we are strengthening our public health care system, and it will be up to the local organizations to decide how they wish to band together, whether they wish to form a partnership, a joint venture,
Opposition, come to order.
But I can tell you that I have been traveling throughout the province, and I have been speaking with groups that are already providing integrated care in Barrie and Bracebridge and North Bay and Arnprior.
Leader of the Opposition, come to order.
Across this province, I can tell you that healthcare providers are excited about having some of the roadblocks taken away that the Ministry of Health has put up over the years, and that patients and providers are also very excited about it, because they know that we are going to connect care for them and make sure that they get care throughout their entire life. That's not happening right now. That's what we are going to do.
Thank you. Stop the clock.